there are 17,683 aggregate confirmed cases of coronavirus in Victoria. That's 240 new cases since our update yesterday. I'm saddened to have to report that there are now 376 Victorians who have passed away as a result of this global pandemic. That's an increase of 13 since our update yesterday. Of course, our thoughts, prayers and best wishes are with each of those 13 families. We wish them well at what will be a very difficult time for them. By way of information, I can confirm that 1 male in their 70s, 6 females in their 80s, 5 females and 1 male in their 90s. That is the composition of those 13 tragedies. 8 of those deaths are linked to outbreaks in aged care settings. There are 622 Victorians in hospital. 43 of those are receiving intensive care, and 28 of those 43 are on a ventilator. A total of 2,028,909 test results have been received from laboratories, which is an increase of 20,279 on tests since yesterday. So that is back to that around 20,000 mark. And again, I'll take this opportunity to thank every Victorian who's coming forward and getting tested. It really is critical for us to have a proper picture of how much virus is out there and to make sure that we're isolating those who are positive away from other people to try and drive that R0 number. So the number of people on average that an infected person in turn infects. That's how we drive numbers down, by having not every person who's got the virus infecting one other, but every second, every third, every fourth and so on. That's how we finish up halving and halving again and putting that pressure on those numbers and getting them down to a much, much lower level. Particularly Ballarat, Bendigo, Geelong. But again, this applies right across Victoria. If you've got symptoms, even the mildest symptoms, please come forward as soon as you experience the onset of those symptoms, no matter how mild. Get tested, isolate till you get your results. It's just a massive contribution that you can make at a very, very personal level to the cumulative fight, the fight that we're all in against this wicked enemy. I can confirm that there are 3,784 cases with an unknown source. That's 33 that have been closed out. That coronavirus detective work has closed those cases out since yesterday, so 33 since yesterday. There are 753 healthcare workers who are active cases. There are 1,811 active cases in aged care settings, and the total number of active cases is 4,864. Alan will go to why those numbers have dropped substantially over the last couple of days. There's been a power of work gone on in terms of that exit process, if you like, going back and making sure that people without symptoms and can return to normal, or at least COVID normal. I mentioned those regional cities a moment ago. Let me just give you the split on active cases. These numbers never tally because there's always a few that are still being investigated, but as best we can, 4,864, that's the total active across Victoria. 4,438 of those are in Metro Melbourne or Stage 4 restriction local government areas. There are 295 that are in regional local government areas under Stage 3. There's a handful of interstate residents, and there's about 130 odd that we are still investigating. So that is good news. If you remember, we had significantly higher numbers, up over 500 if memory serves correctly, in regional Victoria. Those numbers are coming right down, and that's very good. But you've got to keep coming forward and getting tested. We've got to keep those test numbers up so that we can have that most accurate of pictures. And just to give you again across those 3 sites, Greater Geelong 118 active cases, Greater Bendigo 27 active cases, Ballarat and surrounds 18 active cases. So those numbers are more than stabilising. They're in fact coming down. Total numbers across regional Victoria are coming down. That shouldn't lead to any sense of complacency. That's exactly what we want, that they were always low. We want to keep them there and drive them down even further. But getting tested and of course following the rules is a critically important part of that. I don't know that I have any other. Oh, sorry, I'll just do very broadly the aged care outbreaks and cases. As I said before, 1,811 current aged care active cases, and trends in relation to where they're presenting remain absolutely consistent. 1806 private, 5 public. And beyond that, I don't have any other things to update you on. What I'm going to do now, though, is ask the Treasurer to speak to some important extensions of residential and commercial tenancy arrangements. So, for want of a better term, a freeze on anybody being evicted, as well as some strengthening of some advocacy and oversight arrangements for those commercial and residential tenancy agreements, and also the extension of the framework that we've had in place. So just as JobKeeper has been extended by the Commonwealth Government, just as Job Seeker at that higher rate has been extended by the Commonwealth Government, we are today announcing the extension and the refinement of those important protections, both for families and individuals who are renting, but also businesses who've got commercial arrangements and who, through no fault of their own, have got turnover that is a fraction of what it was this time last year.